For Creamer Media's Polity, I'm Mutabi Hwayane. Today we are at Médecins Sans Frontières in Johannesburg to discuss Dr. Neil Agget's legacy and the organization's humanitarian interventions in South Africa. Médecins Sans Frontières has decided to celebrate the life of Dr. Neil Agget. Please remind Polity readers, who was Dr. Neil Agget and what is his legacy?
Okay, so Dr. Neil Agget was an activist who lived during the period of apartheid and was detained by the police, the state security, in the 1980s for denouncing apartheid, very simply, and for his activities in working with the predominantly black trade union movement to get workers to be organized. And another key role that he played was to work as a medical doctor in black hospitals like Baragwanath Hospital and Umtata, which at the time, under the laws and legislation of apartheid, was illegal. And so he played an important role of defiance in ensuring that people had dignity and proper quality access to healthcare.
Tell us more about the work of the Dr. Neil Agget support group.
Just a bit of background on MSF. MSF's been around since the 1970s. Working internationally, and more recently came to South Africa when the AIDS epidemic became recognized as a humanitarian crisis. And MSF set up projects in South Africa, in the Western Cape and in parts of Lusikisiki. And this was during the days when the South African government was in denial about AIDS and the fact that HIV causes AIDS. We were having stupid discussions and debates while people were dying. And so MSF, in partnership with the Treatment Action Campaign, worked to try and understand this and thought about, well, what can we do as doctors to make a difference to this, nonsensical policy? And so in partnership with the Treatment Action Campaign, which is people living with HIV empowered as patients, MSF started projects in Khayelitsha, in the district health, and in Lusikisiki to demonstrate the efficacy of antiretroviral treatment. And the Treatment Action Campaign then used this medical data in their challenge to the South African government to say, we need a policy that's informed by science, and the rest is history. The courts denounced the government's then policy, and today we have one of the largest programs that are treating people with HIV. So MSF played an important role, and that's our history. But then more recently, MSF decided to set up an office in South Africa, in Johannesburg. And I'll explain a little later about various activities, which is including fundraising. But another core activity is around advocacy and working with civil society. And the Neil Agget idea actually came from the work that we're struggling to do, and found his legacy as a real inspiration, especially as a medical doctor, for young medical doctors, healthcare workers today working in a system which is, as we know, fraught with inequalities, where money can buy you quality healthcare. And that's, for us, the indignity that people suffer because of poverty in a healthcare system which should be respecting human dignity. We felt that someone like Neil Agget and what he stood for, we need a similar tradition to work with organizations and activists to try and transform our public health sector.
MSF wishes to challenge inequality in access to health services in South Africa. How do you intend doing this?
Well, firstly, MSF is an international organization, so constantly what we do is we save lives. That's our core social mission in life. Individuals will give up their time to go and work in a conflict situation where people can't access healthcare, or like a long-term disease like HIV, which we know is exacerbated by socioeconomic inequalities, poverty, TB conditions that people live under is what really fuels those epidemics, which are really chronic illnesses in rich countries, because they have treatment and they live under conditions where they can treat the diseases. So that's essentially where MSF works. Now, in terms of working in South Africa, what we want to do is to challenge the fact that in a country like this, where you have juxtaposed huge inequalities of very, very rich people and extremely poor people. And it's really, we're also learning. We want to learn from the legacy of Comrade Neil Agget of what relevance can we be in answering your question of addressing these inequalities. What role can we as Doctors Without Borders play in trying to inspire some kind of change through our work, and using the legacy of Dr. Neil Agget to form some kind of a movement where people are angry and outraged that there is this inequality. That's long term what we hope to do. But on a daily basis, doctors, nurses from South Africa, this year alone we've sent 70 healthcare workers to different parts of the world, Afghanistan, Somalia, South Sudan, to work for periods of time in conflict situations or in chronic situations with chronic diseases. And these doctors come back, these nurses come back to South Africa, and they speak to South Africans about what they've witnessed. And that's a very important part of MSF's work, that we not only treat and are there to ensure that people get access to healthcare, but we also speak out about the root causes of those medical problems. And in a very, very similar way, Neil Agget was angered by apartheid and understood that the conditions that black people lived under and their health was integrally linked to an apartheid system that was an injustice.
What are MSF's main programs in South Africa, and please tell us more about these programs?
Firstly, we work in conflict situations, so in situations like the current war in Syria, Lebanon. MSF attempts to get access so that irrespective of which side of the conflict you're on, you will get access to healthcare if you're wounded in that conflict. And we are facing certain challenges. We're struggling to get access to the civilian population. In some instances, it's because of our Western identity that, for example, in Syria, the Assad regime presumes that MSF is a Western organization, where in fact we're an international organization. And so I think, out of those kinds of situations, we need healthcare workers to stand up and speak about the need for access for civilians in any conflict, irrespective of which side of the conflict you're on. That's a key principle of humanitarianism. We also work in natural disasters. So, for example, the Haiti disaster, earthquake a few years back, floods, and again, it's a very political situation, because if you look at in rich countries, people have the capacity to respond to a natural disaster, but poorer countries don't have the capacity, and so the mortality rate is much higher. The impact of that natural disaster is much higher than in a country where you can respond. And so MSF's role is there to ensure that the impact on vulnerable populations is, we mitigate that impact. And we also speak out about why should poor people be more vulnerable to natural disasters. The symposium is to celebrate the legacy of Dr. Neil Agget. He would have been turning 60 on the 6th of October. And so we were having it on the 4th of October to mark this day. And what we're doing it in very close collaboration with the Neil Agget Support Group. And the Neil Agget Support Group is a loose group of individuals who are directly affected by the death of Neil Agget. The brutal death of Neil Agget, and this was very traumatizing for a large number of people. And it's difficult to mention all of them, but key were people like Dr. Liz Floyd, who was his partner at the time and currently working in the Gauteng Department of Health, Dr. Gavin Anderson, who was a close mate of his, people from the trade union movement, SIPO, many other activists who played a very close role in Neil Agget's life in the work that he did. And so this group of people, including someone called Brian Sandberg, who is involved in Proudly South Africa today, they formed this group to support each other. And when we approached them about the idea of using Comrade Neil Agget's name, they were very keen, and we're now working with the family as well, with Jill Berger, the late Neil Agget's sister, and various other people. So they're all very excited that finally Dr. Neil Agget's medical legacy can be respected and can become known. The key here is to make a link between the long history of the role that many medical doctors, nurses played at critical points in our history, whether it was during apartheid, people like Dr. Steve Bantu Biko, like Dr. Neil Agget, who defied apartheid, denounced apartheid, and paid with their lives. More recently, with denialism, many doctors, nurses sacrificed their careers to say to our government, this is wrong. And they paid a high penalty for that. So many doctors will be speaking at this symposium about what it is that is their duty. Is it just to provide a technical medical service, or is it to go beyond that? So where you treat a patient, but you also stand back and look at the broader context. You do analysis as a medical person. And so it's not just about treating the sore, but actually addressing the bigger challenges where there are those. And that's key in then inspiring young doctors, young medical students. That's our target, to say we have a crisis today and you need to play a role.
What are the main challenges that MSF experiences in advancing its programs?
Like I said, I think that there's a huge need. Vulnerability of populations is increasing, whether it's because of lack of affordability. So, for example, antiretroviral treatment is incredibly expensive. And if you're rich, you can pay for it and you can live, and you live a long, healthy life. But in countries like Southern Africa, which is the heart of the epidemic, we have very impoverished communities that are more vulnerable and susceptible to this disease because of the conditions they're living under. And now we need to intervene to ensure that that it's not just money that buys life. Then the other challenge is then to ensure that we empower communities and patients and build networks where possible. And that's why we want to strongly lean on Dr. Neil Agget's legacy of working with trade unions as a medical doctor, as a white person who broke down so many barriers, so many boundaries that were built by apartheid as a legal system. And we're hoping to maybe help to challenge some of those problems that we're experiencing today.
How can leaders and citizens boost efforts towards overcoming the challenge of health inequality in South Africa?
I think the first thing is to be outraged by inequalities, irrespective of whether we're in a democracy, whether it was under apartheid, where people are denied access to healthcare, where there's no respect for human dignity, irrespective of whether you're legal, whether you're illegal, whether you're poor, whether you're rich, whether you're black, whether you're white. We need to be outraged, and we cannot turn a blind eye. So whether we're professionals, whether we're public servants, whether we're students, whether we're doctors, we need to be angry about this and make sure that we address it, whatever means. And I think that's partly what we're wanting to do with various other organizations. But very specifically, MSF is holding a fundraising event. 90% of our funds, 80 to 90% of our funds comes from individuals from society, people like you, me, others who want to contribute towards the work of the organization. So I think that's also an important role, because if we take money from a state or from a government, then our hands are tied to that financial obligation. So, but individuals who give money without any strings attached means that we are at liberty to work and to ensure that we don't compromise on our principles.